Hi, everyone. I'm Dr. Swanson alongside Dr. Shaw from KSB Foot and Ankle, and we would like to welcome you to tonight's presentation. I'd like to thank KSB Community Wellness and Aaron Fox for putting this on as well. And we thought that since school is about to wrap up and summer's right around the corner, we would like to give you some tips and advice on keeping your feet healthy this summer. So topics we're going to cover this evening include injuries, footwear and sock recommendations, skin care in different conditions, and then when to seek medical attention. All right, I'm going to turn it over to Dr. Shah, and he'll begin with injuries.
All right, thank you, Dr. Swanson. The most common injuries that we see with foot and ankle is probably plantar fasciitis. So plantar fasciitis is commonly due to pain in the bottom of the heel, and it's usually in the arch area. Usually you feel feel the pain the worst with the first few steps in the morning or after sitting and standing up after prolonged time. Some of the treatments include RICE therapy, which is rest, ice, compress, and elevate, and anti-inflammatories. Sometimes doing steroid injection into the heel is pretty good pain relief. In addition, stretching out the posterior calf muscles is instrumental in getting pain relief and preventing it from coming back. And lastly, wearing supportive shoes and orthotics can help prevent it from coming back as well. Foot and ankle sprains. As we all know, when we're playing sports or any other types of activities, sprains can be very common with the foot and ankle. And this usually involves stretching and tearing of the ligaments. And they can occur a variety of locations in the foot and ankle, especially on the outside of our ankle. Some of the symptoms include pain, swelling, bruising, and often not being able to put weight on the foot immediately. Again, the treatment are pretty similar to what we talked about for heel pain. So the RICE therapy and anti-inflammatory. If it doesn't get better, doing physical therapy to help strengthen the ligaments and tendons around that. And then gradually increasing the activity, as you don't want to jump right into it, as it can cause another injury. And wearing supportive shoes and orthotics. Tendinitis kind of falls within the same category of ankle sprains, but tendinitis means it's an inflammation around the tendon. And the three most common tendons that we see in the foot and ankle is the Achilles tendon, which is the big tendon on the back of the leg, which attaches to the back of the heel, the peroneal tendons, which is the outside of the ankle, and then the posterior tibial tendon, which is on the inside of the ankle. Symptoms again include pain, swelling, and difficulty to put weight, and treatments are pretty much the same from what we talked about. Metatarsalgia. Fancy way of saying there's pain underneath the ball of the foot. This is usually due to increased pressure and activity. And oftentimes there's some biomechanical etiologies to this, which is hypermobile first ray when you have excessive motion. If you have a long second metatarsal, putting extra pressure underneath that area, and oftentimes people see calluses form underneath that, which is body's way of adding extra cushion under a stress area. Or if you have a really tight Achilles tendon, which puts more pressure in your forefoot area. Treatment, one of the big things is to have good supportive shoes and orthotics, and sometimes identifying the underlying etiology to correct that and getting the pressure off of that. Stress fracture versus a natural fracture. So usually this kind of presents for foot and ankle is usually pain in the foot and ankle. For a stress fracture, usually there's no real inciting event or a traumatic event that a patient can recall. Versus a fracture, patient will come in and say, hey, something, I twisted it, something fell on my foot or ankle, and so on. So usually those are two different categories of pathologies that we see. Oftentimes stress fractures are not visible on x-ray immediately versus a fracture that can be identified pretty quickly on x-ray right away. Some of the symptoms include swelling, bruising, and difficulty to put weight on it. Some of the treatment, usually, regardless if it's stress fracture or a fracture, is protecting it, and giving them some anti-inflammatories. Also checking vitamin D supplements and calcium just to ensure that it has adequate amount of nutrients to heal. Supportive shoe gear and orthotics, and then again, slow progression of activity.
Thank you, Dr. Shaw. All right, well, next we have shin splints. So shin splints presents as pain along the shin bones. It's usually caused from overuse, whether it be excessive walking, running, other activities. You can have pain in the front and back of the leg, and treatment options is pretty similar to the previous treatments that Dr. Shaw had mentioned earlier as well. Callus, pre-ulcer, and runner's toe. Well, a callus develops from increased pressure on the foot. The body responds to that pressure by laying down more skin tissue to protect itself, and that extra buildup of skin results in a callus. If these are untreated, the callus will build up and you can actually develop a wound or an ulcer underneath, and that can become very serious. Treatment involves keeping the callus trimmed or pared down, using moisturizer on the feet, various offloading pads to help reduce pressures to certain areas, and then wearing supportive shoes and orthotics. Runner's toe, that is a painful darkened toenail due to repetitive microtrauma. So when we are in shoes and the toes are hitting the ends of the shoes, that buildup of microtrauma causes bruising and bleeding underneath the nail, which results in that darkened discoloration. Sometimes patients will lose the toenail and sometimes they will not. Other treatments, we may need to drain the hematoma or build up of blood. The nail typically regrows about 6 to 9 months if it's a lesser toenail, and the great toenails take up to a year. And it's always important to wear properly fitting shoes. So shoes and socks. So picking a stable shoe, there's usually 3 tests that we do to do this. And what it involves is if you grab a shoe, here, I'll show you. So take your shoe, and if you bend it like this, it should only bend where your toes bend. Should not be able to fold it in half. The second test is when you do this, it should be nice and stiff and supportive. And then the last test is the heel counter. When you press on the heel, it should not collapse. There are supportive sandals and other tennis shoes that can be appropriate for certain activities. And it's always important to keep your sandals and shoes clean and dry. Avoid going barefoot outside, and then wearing socks that can help wick away moisture can be very helpful as well. And socks that include materials such as nylon, wool, and polyester can help assist with this. Skincare. So now that the sun is going to be coming out more and we may be wearing sandals or even going barefoot on the beach, it is important to always use sunscreen. SPF 30 plus is recommended to help prevent sunburn. Utilizing bug spray can be helpful as well. And when using moisturizer, moisturizer with vitamin E can be very helpful. Others we recommend Eucerin, Aquaphor, Cetaphil. Keeping hydrated and daily feet checks is always important. And then avoiding lakes or ponds or other areas of open water when you have an open sore or wound. Other common skin conditions that we see include blisters, athlete's foot, which is a fungal infection, plantar warts, which is a viral infection, sunburns, and then poison ivy and poison oak. So if you're concerned that you may have developed one of these conditions, we would be more than happy to help assist and treat these for you. So when to seek medical attention. Whenever you have signs of infection, which include pain, redness, drainage, or you're feeling ill, nausea, fever, chills, those type of symptoms, it is always important to seek medical attention. And never forget with puncture wounds, whether that be a nail, wood, glass, etc., these can be very serious conditions and may not present initially as a concern, but infection can build up underneath the skin. So if this occurs, we highly recommend seeking attention. And it's always important to keep tetanus immunization up to date as well. Whenever you have injury or trauma that results in pain and that pain does not go away or it worsens, along with continued swelling, bruising or increased bruising, and then when you cannot put any weight on the foot is also a time to seek attention. So we'd also like to add in that the 2024 Reagan Run 5K will be on July 6th this year. The Reagan Run will begin at 8 a.m. and then the Kids Fun Run at 7:30. I did leave the URL for additional information online, and KSB Foot and Ankle will be at the medical tent and can assist you with any foot or ankle ailments that you may experience during these events. So that concludes our presentation this evening. I hope this was helpful. And once again, I'd like to thank KSB Community Wellness and Aaron Fox. And we hope everybody has a great start to their summer and be safe out there. Thank you, and we'll see you next time.